Assalamu alaikum. I am Dr. Pervin Akter, Professor and Head, Department of Physiology, Bashundhara Ad-din Medical College. Today I am going to deliver my lecture on regulation of respiration. So, let us start. The normal rate of respiration in adult is 14 to 18 per minute. So, respiration is controlled by a special group of nerve cells in the brain stem which constitute the respiratory center. The activity of this center is controlled by neural control and chemical control. Neural control is consists of voluntary control which is located in the cerebral cortex, and automatic control group of neurons present in the medulla, and chemical control. Respiratory center is composed of a several group of neurons located bilaterally in the medulla oblongata and pons of the brain stem. There are three groups of respiratory center, that is the dorsal respiratory group of neuron, ventral respiratory group of neuron, and the pneumotaxic center. This is the figure of the respiratory center, which is shows the different type of respiratory center. Now, the dorsal respiratory group of neuron location, dorsal portion of the medulla, nucleus is nucleus of tractus solitarius. Dorsal respiratory group of neuron mainly causes inspiration when stimulates, and basic rhythm of respiration is generated mainly in the dorsal respiratory group of neuron. And what is the Prevost complex? Rhythmic respiration is initiated by the synaptically coupled pacemaker cell on either side of the medulla between the nucleus ambiguous and the lateral reticular nucleus. These neurons automatically and rhythmically discharge in the phrenic motor neuron. And this is the location of the Prevost complex. Now, the pneumotaxic center. Pneumotaxic center is located dorsally in the nucleus parabrachialis of the upper pons, and it transmits signal to the inspiratory area and control the switch off point of the inspiratory ram, thus controlling the duration of the filling phase of the lung cycle. And its primary effect is to limit the inspiration, and secondary effect is to increase the rate of the breathing. And now, the ventral respiratory group of neuron. This neuron is located on either side of the medulla about the 5 mm anterior and lateral to the dorsal respiratory group of neuron, and nucleus is nucleus ambiguous and nucleus retroambiguous. And function of this neuron is, the neuron of the ventral respiratory group of is remain totally inactive during the normal quiet inspiration, and it causes mainly the forceful expiration when the pulmonary ventilation is increased. Now, the inspiratory ram signal. The nerve signal transmitted to the inspiratory muscle is not an instantaneous burst of action potential. It begins weakly and increases steadily in a ram manner for about 2 seconds. Then it ceases abruptly, and for the next 3 seconds turn off the excitation of the diaphragm and allows the elastic recoil tendency of the lung to cause the expiration. Thus, the inspiratory ram signal begins repeatedly with the expiration occurring between. So, the inspiratory ram signal is a ram signal. What is the importance of the inspiratory ram signal? Inspiratory ram signal causes a steady increase in the volume of the lung during the inspiration rather than the inspiratory gaps. Now, the hearing-bearer reflex. The rate and depth of the respiration is controlled by the reflex, which is transmitted from the stress receptor of the lung to the inspiratory center through the vagus nerve. Two types of the hearing-bearer reflex, that is the hearing-bearer inflation reflex and hearing-bearer deflation reflex. What is the hearing-bearer inflation reflex? When the lungs become overstressed, stress receptor located in the lung, mainly in the bronchi and bronchioles, are stimulated during the inspiration. The afferent impulse transmits signals to the vagus nerve into the dorsal respiratory group of neuron and stop further inspiration. So, it stop the suture point of the inspiratory ram. And importance of the herring-bearer inflation reflex is it is a protective mechanism for preventing the excess lung inflation during the inspiration and increase the rate of inspiration. And in human being, the reflex is not activated until the tidal volume increases to more than the 3 times normal. And what is the herring-bearer deflation reflex? So, when the stress receptors in the wall of the lung alveoli become unstressed during the expiration, the impulse from this receptor ceases, which allows inspiration again and again. Now, the chemical control of the respiration. 3 factors act during the chemical control of inspiration: excess hydrogen ion concentration in the blood, it is a potent and direct stimulus, and increased partial pressure of carbon dioxide, it is a potent and indirect stimulus for the chemical control, and decreased partial pressure of oxygen in the blood, it is the indirect stimulus. And chemoreceptor, the central chemosensitive area and peripheral chemoreceptor is carotid body and aortic body, and location of the peripheral chemoreceptor are 0.5 millimeter beneath the ventral surface of the medulla, and it is located in the bilaterally. And this area is highly sensitive to change in either blood, partial pressure of carbon dioxide and hydrogen ion. Now, the effect of increased hydrogen ion concentration. This sensory neuron in the chemosensitive area is especially excited by hydrogen ion, but though it is the direct and potent stimulus, but it is not directly does not cause the blood-brain barrier. So, it has less effect to stimulate the central chemosensitive neuron than carbon dioxide. So, it acts secondarily by through the carbon dioxide, because carbon dioxide can directly cause the blood-brain barrier. So, effect of increased carbon dioxide concentration have little direct effect on the chemosensitive neuron, has a potent indirect effect, but it can cause the blood-brain barrier. So, increased blood partial pressure of carbon dioxide, increased partial pressure of carbon dioxide both interstitial fluid of the medulla. So, carbon dioxide can react with the water, so it form the carbonic acid. Carbonic acid then dissociate into hydrogen ion and bicarbonate ion. Is hydrogen ion then stimulate the inspiratory area, and then it causes increase the rate and depth of the dorsal respiratory group of neuron. In hydrogen ion then have a potent direct stimulate for chemosensitive area. So, excess hydrogen ion and carbon ion also excite the peripheral chemoreceptor. Peripheral chemoreceptors are located bilaterally in the bifurcation of the common carotid artery, and afferent nerve from this pass through the Herring's nerve, glossopharyngeal nerve and dorsal respiratory group of neuron, and aortic body are located along the arch of aorta, and afferent nerve from this pass through the vagus nerve and then stimulate the dorsal respiratory group of neuron. And effect of partial pressure of oxygen, changes in the oxygen concentration have directly no direct effect on respiratory center. So, it has indirect effect acting through the peripheral chemoreceptor. This mechanism responds when blood partial pressure of oxygen falls to below 70 millimeter of mercury. So, this is all about my lecture on the regulation of respiration. So, Allah Hafiz. Assalamu alaikum.